We are going to move to our Q&A section, and I'm so glad for all of you that have placed comments in the chat. We'll go through and answer as many as we can in these last few minutes. The first one is, how is EndoTool integrated into the EMR? Is it utilized in Epic? Is it available to outpatient use? I'll go ahead and answer that in this current environment for our panelists today, they use it in the inpatient areas. But Christy, do you mind to discuss a little bit how it's integrated into the EMR?
Sure. So we use Epic in our inpatient areas. So when a patient is ordered an insulin drip, there is an icon in the fast toolbar buttons, if you're familiar with Epic, and the nurse simply clicks on that button. It's a blood drop, to be honest, and it launches them out to EndoTool. We have interfaced demographic ADT data that crosses on the patient. It goes directly into the patient record within EndoTool, pulls in the most recent CGM or BG reading, and then makes the recommendation. And that's where within EndoTool, nursing will get scripting messages that, based on potassium levels or blood glucose levels, that they may that they should initiate DKA, standing order fluids with electrolytes. So there's all sorts of messaging that we incorporate in there too to help guide the nurse in caring for the patient on the insulin drip. But they only go into Epic, hit a button, it takes them out to EndoTool, and then that information feeds one another. We have EndoTool reports that pull into Epic, summaries that you can look at in shift handoff and that providers can see as well. Our providers primarily just work within Epic, not within EndoTool. Our nursing staff is really the only ones launching out to Epic, launching out to EndoTool to get that dosing recommendation during the drip management.
And I don't know if you mentioned, Christy, when a provider orders EndoTool, they select all of the aspects of the care, the mode of therapy, goal range within Epic, and then that moves right in over into.
Yep, all of that crosses over, so it's there when the nurse launches to EndoTool for the first dosing recommendation.
A lot easier for the nurse in that regard.
For sure.
Our next question is, what is nurses' opinion about utilizing the software for glucose management? And Christy, I feel you actually addressed this one a little bit in the final question at UPMC, sharing that they did not like the insulin drip, but they preferred EndoTool over the previous protocol. Megan, what would you share, or could you give nurses' opinions at HCA with utilizing it?
Yeah, so I think that it tends to be kind of the common denominator across the board is that, insulin drips are heavy workloads, and it doesn't matter how you slice it. But with EndoTool, we've had a lot of feedback that we're taking a lot of that, cognitive burden away from them, not having to calculate and follow, the graphs or the chart, and really just reducing their worry of making a med error. And so being able to put in the glucose and get a drip rate back, and knowing that you have an algorithm behind the scenes that's working towards managing this patient, it's not up for, variability or error based on an individual. They also like that. So for that instance, they like the easiness of it. Log right in, get a glucose, get a drip rate, change it, move on. So they like that easiness of the workflow and not having to, calculate it themselves, but also they like that they can cover for each other. And so that was one of the things that we found, that if you, have a nurse off the unit for, procedure with a patient, or you have a nurse at lunch and you're trying to cover, knowing where they started and where you were supposed to go was really, really difficult, and, was going to be a high, risk for an error at that point. And so EndoTool doesn't care what nurse is logging in and what nurse is making the titration. It's going to keep the course regardless. So they are able to help each other a lot more, which has been great.
Thank you for answering that one. Our next question, Jennifer, I'll give this one to you. What areas of the hospital do you use EndoTool?
Right now, at Atrium Health Wake Forest Baptist, we are still within critical care units and then that intermediate care unit. And that's also where we have taken it to another one of the other hospitals in the Atrium Health Wake Forest system over in High Point. Still sticking to those. There's a lot of interest on potentially rolling out eventually to the sub-Q version of EndoTool, but we are not there yet and have to hold on that because of already, I think we are in the process of merging two Epic systems across the our region, which is a challenge. So of course some other projects have to go on hold because of that. But we have started there, and of course that's where the insulin drips are mostly utilized, and hopeful to move into the emergency department after that EHR harmonization happens next year. We can't roll out as fast as we would like, to be honest.
And just for our audience, are there any areas that Jennifer has not mentioned at either HCA or UPMC that are also there? I'll let Christy go first.
So areas that that are excluded for us right now?
Or areas that Jennifer had, it's within critical care at Wake Forest Atrium Health. Are there any other unit areas that are utilizing EndoTool at UPMC?
So we utilize it in all of our inpatient adult units. We do not do it in pediatrics, and we do not do it intraoperatively. So when a patient goes to the OR, they become out of scope, and that's managed by anesthesia until they go back to an inpatient unit. However, there is interest from initially our OR chose to be out of scope for pre-op, post-op, and intra-op. However, there is some recent interest from our OR teams to add post-op so that it eases that transition from a patient out of surgery to the inpatient unit. So that's probably our next area of expansion.
Spring, I just thought of something with when you spoke with Christy. There's interest as well from a labor and delivery perspective, and that's somewhere, like I said previously, we don't have it currently, but there is interest in trying to roll out there eventually.
Yeah, and I should mention we do use it in our women's area, so we use it in labor and delivery, antepartum, postpartum for those patients that it's applicable to, and have worked with, obviously our physician champions, our physician leaders in those areas to, develop the algorithm that's used for that specific population. It's a little bit different, obviously, than our adult inpatients.
Yeah, we have it in our OBs and our ER as well. Christy, I echo your, interest in particularly the CV ICU OR. That's where the insulin drips are getting started on all patients. And so really to just have continuity of care, we also would love to move there. And then we don't use it on any of our adult units. So a lot of that was driven by nursing ratios and that sort of thing. So we use it in our ICU and our only ICU step down. We do use it in that unit because nursing ratios are smaller. But I do think that there is, an opportunity to use it in some of our other like PCU areas. Also knowing that you can utilize a tech or a nurse extern or something like that to obtain the blood glucose, and then the nurse would actually be titrating the drip. So that's something that we haven't seen a high need for that, but, there is definitely some patients that could benefit from the drips in those units that we don't currently use.
Thank you all for sharing. It is very cool that it is available in a lot of different areas and units. I do want to just state that EndoTool is also available for use in pediatrics down to 2 years old and 12 kilograms. But it is, again, very neat to see that it's in use throughout your different units and that there's areas for expansion as well. I see some typing, so I'm not certain if another question is coming in or not, but I would like to give you all the opportunity if there was just any final thoughts you wanted to share or something you wanted to add for the topics that we have covered. This is a great time to do that if you have anything you want to add in addition.
I'll mention that I do think it is a valuable partnership with Monarch. I appreciate the at the elbow support that was given with those first patients, because I think Christy talked about, you know, if you're doing an education module, it's just not the same as when you have a patient there in front of you. And so that was, you know, we were all a little nervous with that first patient, but trying to work through it, and just appreciate Monarch's continued help when we need to troubleshoot, you know, a particular issue. And I know something that we talked about recently as well is like with downtime procedures, just with your EHR or things like that, they help with that as well. So just it's been great, and we just like I said, we want to be able to roll it out to other areas, and it's just it's a slow process in a large system. So appreciate the patience that our physicians have as we're trying to roll it out as quickly as we can.
Well, and you definitely have multiple competing things going on just internally, but we definitely pride ourselves and aim to offer excellent support.
I think I'll also add that, you know, it feels like a heavy lift at the beginning to get something like this off the ground. But I will say, you know, after having it and doing it, I can't imagine going back. And so I also think that as nursing shortages continue, you know, to be an issue around, and we have a lot of travel nurses and that sort of thing, it is a process and a system that is able to be utilized and done effectively with someone that's not even familiar with it. So, you know, we obviously try to make everyone as familiar as possible, but teaching the old paper system was difficult to do to a nurse who was new to our system. And so EndoTool is very user friendly, and so it's something that we have found that nurses really pick up on quickly. And I know with, you know, how bedside nursing has been over the last few years and will likely continue to go, there will be a lot of movement around. And so really having a tool that, you know, you can still give great patient care with safety is important.
We got another question in. You mentioned travel nurses. Is it difficult to educate them? Christy, do you mind to take that one? How would you approach educating a travel nurse at UPMC?
So at UPMC, we actually have our own travel agency, UPMC Travel Staffing. So we do get a lot of travel nurses within our 7 hospitals that maybe work in our other facilities outside of Central PA that don't have EndoTool. And they do find we've developed 2 things. One is they do the online module for EndoTool. We included it in our traveler education since we do it everywhere throughout the system. So we included it. We do like a 2-hour Epic refresh for patients coming into our system with workflows, even if they've had Epic experience. We talk about, you know, pump interop and this and some specific workflows within our system. And then we have a 1-page tip sheet that's included in their unit orientation from the nurse educator. So it has been an area that we've recognized a need for, but in our rounding, we haven't, we've gotten positive feedback from the travelers that they really like it. They wish, you know, other sites that they were at had it and managed it. So no problems, so to speak, that I can speak to, except for the fact that we did, you know, find definitely the need to develop traveler education for it, since we have our own travel agency within UPMC. So that's a pretty frequent occurrence for us.
Anything that you would add for either HCA or Wake Forest that you guys do for travelers?
No, I guess I just will say that when we finally went live with all ICUs, that was helpful, right? So if you have a travel nurse that's bouncing between ICUs, we found it was difficult for them, or even our shared staffing nurses, it was difficult for them, and they often wanted endo tools so that, they didn't have to try to do those manual calculations. And so really consistency across the board, I think makes you more successful.
I think at Wake Forest, we utilize similar approaches to what Megan and Christy have said.
Thank you all. It's very much worthy of note that standardization does take some of that burden off the nurses and just the healthcare team in general. And I think at times, certainly across different facilities within an organization, but even across different units within an organization, it comes to the surface how different sites are handling things when you bring a program like this in, and standardization is almost required in some areas. Christy, we didn't give you a chance to share any final thoughts. Was there anything else you wanted to add?
Just at a high level, I wanted to share, we just had our 1-year anniversary on endo tools. So we had a chance to do some data analysis and share that as a win with our nursing teams. And just as, data talks, right? Like people really do like seeing, how this is working. So we've had 3,100 patient runs in a year at UPMC Central PA hospitals. And we compared those to, our averages for our patients that were on insulin drips prior, and had I think I mentioned it once before, a 46% decrease in BG checks. So we used to check on an average person's check their blood glucose 67 times on an insulin drip run, and now that's down to 25.4. And on average, our patients are on insulin drips for 17 hours less than they used to be. So when you talk about that burden of care and that cognitive burden, that's huge for nursing to have a patient on it for 17 hours less. And I bring that up because, our nurses work 12-hour shifts. So I think that was really powerful data for them to hear, because they take care of a patient on an insulin drip for 12 hours, but don't necessarily know, that patient comes off a few hours later, et cetera. So, I mean, cutting that time so significantly, definitely, we're definitely seeing that decreased burden for our nursing staff. And we have 4 times less hypoglycemic events than we had prior to going on endo tools. So that's the other thing with nursing burden that we try to share with our teams, is that work that they're doing proactively, giving the supplemental carbs and, staying on top of the insulin drips, decreasing that work from complications, from patients becoming hypoglycemic, having to do the treatment, having to do additional lab work or, things that the patient needs, and keeping them, on the drip longer in the hospital longer. So I think the data has been really powerful, and our nursing team was excited to see that.
Thank you so much for sharing that. Data really does speak, and that is just wonderful to hear. And then some of the data you shared, Megan, about that decrease in length of stay at HCA, that is just really powerful. I want to encourage everyone, if you have any other questions or want any additional information, please go to www.monarchmedtech.com. There's some information there. You can also reach out directly to Dr. Paul. He is a wealth of experience and insight, and is always available to answer any questions and help with understanding how you and your organization might move forward, or options that you can pursue. Thank you all for your attendance today. Thank you to our panelists for sharing, and I very much appreciate your time and attendance.